Hi, I'm going to take you through this morning for those that haven't had a stoma, haven't got their stoma yet, haven't been through all the hassle, all those that just have and they're dealing with the bits and pieces, haven't gotten the way of sorted of how do I change my bag or the whatever. This is how I deal with my bags and so on. Changing the bags. One of the ways, do it in two ways. One will be in the bath, in the shower. I have a shower, and I'll show you that later on. I'll keep my undies on so that no one gets embarrassed. But I'll show you about changing the bag from the shower. A lot easier in the shower in one sense. The biggest problem changing your bag when you're outside of the showers anywhere, even when you're out in the restaurant and so on, you need to change your bags. I've had to do that and so on. Is how do you cope, not so much with changing the bag, but in between. So we're going to go through some of that. First of all, I'm using a two-part system. Okay, let me show you from here. Two-part system. This is my bag. Stoma's on my right-hand side. I believe most people have theirs on the right-hand side, but no, I had a choice. Well, I chose on the right-hand side. And I use that one, comprehensive, the flanges, and these bags with the things, and this basically attaches to this. I keep mine in a bag as a set there. I got this when I was diagnosed and had my thing, and they gave me the bag with all the things, and I put my stuff into there. And the way I use it is I open them up as if you've got the flangey ones, and as I open them up, and you have a pre-cut. I'll show you how to do that later. But what I do is I pre-cut a hole and then put it back in the bag, and I have one that's marked out ready for the hole. And the reason I do that is because of drying out. I want one handy if I need it in emergency. I can come along, change over without having to cut holes, mark it out and cut holes and stuff. But I don't want to be, if it's been a while, then I don't want them to dry out. Okay, that's that bit there. Dry out. What do I mean about dry out for those that haven't got theirs yet? With these type here, right, I'm going to bring this slightly further down because you don't need to see my head anymore. Still here, but you're more important down here. Okay, on the back here, you see where the flange is. It gets all ruckled, and this is ready for changing this one. This is why I'm going to do it now. They dry out. Because they dry out, there will less flexibility for moving around. If you're very sedentary, then it doesn't make. I think you've got a bit more advantage because it just sets almost, and it doesn't matter. But if I do yoga and all sorts of things. So yeah, if you're moving around, it ruckles around. Okay. So what I tend to do is if I'm changing it, as I lower down to here. That's so that what I'm going to do is I'm going to put my body against the sink. And I'm going to use the sink as the catch. Okay, I should have a spray here somewhere. Normally I would empty my bag first before getting it ready for your bag here. So you get your bag ready first. Little black bags, I get these as well. You should be able to get these from your suppliers. So you get your bag ready, and I would normally empty this into the toilet first. It doesn't make a lot of difference because it's going to go in the bin anyway. But to save time here, I'm just going to do it. Use your spray. The spray loosens the adhesive on the back of the flange, and you can probably see then if I do this. More of how it's ruckled up. Yeah, they start to dry out and they ruckle up, and the white thing on the inside there, if you leave it too long, then it sort of creeps to the edge and the opening here as it comes away from the skin, and the edge from here, and they sort of meet, and then you'll get your leaks. That's what happens with the leaks. Okay, I'm just going to chuck that into my bag out of the way, and if you've noticed what I've done, all I'm doing is pressing myself against here. And they should give you some little wipes, and it's just basically the same as what they'll do in the hospital when you come out and they say, okay, give that little tray basin, paper basin, and you wipe it over. You do the same thing here. Okay, just give it a little bit of a wipe. Treat it gently. Okay, if you treat it too roughly, then it can bleed, and you're going to start getting complications. Especially at the beginning, when you're near the beginning, go very gently, because you've got your stitchy things round the edges as well, around the edge of this here. Okay, after a while it heals up and becomes almost like normal skin. But it is a weak point, so I always treat it gently. Occasionally, it's not happening today, but occasionally you'll get spots of blood on there. But that's nothing major to worry about, because once you've it's not sort of flowing blood, it's just where you've perhaps rubbed a bit hard on the skin, because this is delicate skin on the end of here. Yeah, it's all right. It's not the end of the world. Yeah, it's fairly robust, but it's not. Yeah, you can hurt yourself, as it were. Not majorly, but the less damage you do to yourself, the less problems you'll get, is what I'm trying to say. Yeah, so treat it gently. Okay. One of the things you're trying to do when you're wiping this off is get rid of the sticky, if there's any sticky tackiness to the bag, because then the next bag flange is not going to stick to the skin. It's going to adhere to the stickiness, which isn't that sticky as the new one, and then it's more likely to come off. Okay, so you're going to wipe yourself off. It might take a couple of goes, or a couple, depending on what's happening there. Okay, and then you get yourself some dry ones. Make sure it's nice and dry. Also, what I've personally done is every so often I shave this area here. Okay, I gently shave it so that you don't pull, none of these hairs get pulled off. If you don't pull them out, if you're going to make it, if you're going to exfoliate, don't pull them out like the women do with their things, what have you. Just gently shave, because when you pull them out, the little hole things, that you can get infections in them. Yeah, so it's not the same as doing your arms or anything like that. Yeah, so again, it's about treating them gently. What I'm actually doing at the moment is almost waiting for what normally happens. Okay, I tend to do this, change my bag first thing in the morning before breakfast and everything. One of the reasons is there's not a lot of fluid in the system to go through the kidneys to come out, because generally speaking, what I will do on a personal level, you don't have to do, you can keep using these, but I tend to use a towel as well to dab around the outside to make it dry. Okay, once you're dry, and I keep my body against it all the time. Get that out of the way, get my fan, peel the back off. Okay, and I have mine on a slight angle. Okay, I'm going to come to this mirror in a second, and I will show you this mirror in a bit. This is what I use. I use a mirror for putting it on. I bought it off Amazon. It sticks to the tiles of the wall, and then you can move this mirror around wherever you want it. I've got it at the side of the bath, so I can use it when I'm in the bath or in the sink. So it's handy in your own home. Fair enough if you haven't got it in the restaurant or wherever, but it's here handy for when you want it for yourself. So I'm going to turn slightly. In fact, I'll do it here. If I get an idea from that. Right, what I want to do is turn it Get it roughly in the right place. And what I'm doing here is making sure that this, because it's not exactly round, spherical, but I've turned it slightly so that I can, most of this is going inward here, because I've got a dip in here, so most of it's there. If I turn it sideways like this, it's more likely to, if it starts to come up, there's less of a gap there before it meets the middle. So what I tend to do is do that at a slight angle, then push it down. What I tend to do first is put it on, go round here. So the first thing you do is put it on, go round here. Because if Mr. or Mrs., whatever you want to call yours, okay, starts to spurt, if it's not on here first, stuck to this part here, then it goes down the back, then you're going to have to take this one off and get another back. If it's stuck to here, it doesn't matter because it'll come down to here, but it's already stuck there, and you just push this on here. Okay, so this bit first, make that nice seal, then push the rest of this round, and you're ready. And my little stoma's being kind to me today. The one time when you don't mind it going or dribble, dribble, dribble. Okay, okay, from there you're going to then put your bag on. Okay, and it would have normally done its business by now, dribble. And what the whole idea of this is, if it comes down, it starts to dribble. If it spurts into the sink, better than all over the floor, all over your clothes. And if it dribbles down to here, and then to the sink. Okay, which is why I've lowered this down here, so it doesn't come onto your trousers or your skirt or whatever you're wearing there. Okay. I'm not going to wait here 10 minutes waiting for it to come out. So, okay, we're just going to, there's a little indent here and an extrusion here. And you just push one into the other, and it's almost like pushing a cap onto a bottle. Make sure you go all the way around. Don't just go 1, 2, it's on. I've done that when I first started. And I tend to go around the edge, give it a little push all the way around to make sure it's all the way around. Because I had a leak a couple of times. After your second time, you notice what the problem is. But all I've done is pushed it down, but you haven't pushed it on one side or the other or something. And there's a gap there. So as it fills up, you move around, and then it'll come out. Okay. So now I'm safe. I can step away from the sink because the bag's on there, and we're all safe. The mirror, whilst I'm here I can talk about the mirror. I'll pull this up for a second, so I'm comfortable. Okay, if I draw this across here, I'm going to take this off actually. And take you, excuse me, not very professional is it? Okay, but, so this is the mirror. Oops. There we go. So this is the mirror here. Just clamps onto the back there. But this one's a turn. Quite often you have a little thing that you pull to make it suction. On this one it's a turn. I'll turn it one way and it comes off. Okay. I'll turn it the other way and it grips back on. Okay, and this one then, because it's flexible, you can have it wherever you want. You can go down, or you can come and bring it up, and you can then position it to wherever you want it, because it moves on the swivel here as well. It's got a swivel point at the back, very handy. When you clean them, because they get bits on, don't use any sort of abrasive motion or anything at all. Just a damp cloth and let it dry. Otherwise, because this surface is actually quite, well, I did it a couple of times and I marked the mirror surface. Okay, that'll do for a minute, and I'll do you one from the shower, but it's even simpler because basically just putting your bag on. Move my hand out of the way for you. On the shower. Okay, so you're in the water and you just do everything in the bag. I have a tendency to lean slightly forwards so that if it spurts it doesn't drag all the way down the leg and the body, rather than using the sink. But I'll show you that and another one. Okay, that's it for now. Hope you've learned something. Hope I've been helpful.